AI, epidemiology, and disease surveillance. Epidemiology is the study of the distribution and determinants of health-related events in populations and the application of that study to prevent and control health problems. It has expanded from its traditional role of studying infectious and chronic diseases to other types of health-related events. Epidemiology is a pillar of public health. Epidemiology asks, what is the health issue? Who is affected? Where does it occur? When does it occur? Why or how did it happen? What is the burden of the disease? And what is the impact of intervention? By tracking patterns over time and across populations, epidemiologists aim to uncover risk factors and effective interventions. There are two categories of epidemiology. Descriptive epidemiology describes the patterns of the disease, and analytic epidemiology tests hypotheses about the cause and interventions. Disease surveillance. Disease surveillance is a core function of public health. It is the systematic, continuous collection, analysis, and interpretation of health data. These findings are disseminated to public health officials who can act. Surveillance provides an early warning of emerging threats, track how they spread, and measure the effectiveness of interventions. Because it is built around gathering and deciphering those health signals, surveillance is essentially the data-driven engine of epidemiology. Epidemiologists ask the questions, and surveillance supplies the real-time evidence that lets them test those hypotheses, quantify risk, and guide public health policies. AI and disease surveillance. Let's look at why AI matters in surveillance. Outbreaks are getting more complex and moving faster. Early detection reduces spread and cost. Data volume exceeds the manual capacity. And AI changes the speed and scale of the decisions. AI accelerates and sharpens disease surveillance by turning raw data streams into instant, reliable signals. It analyzes thousands of reports from hospital admissions, laboratory results, pharmacy sales, emergency department calls, etc. It even gathers internet search queries and social media posts in real time. Machine learning models can scan the internet searches and social media feed for clustered anomalies, flagging potential outbreaks long before clinicians or public health officials spot patterns. AI-driven natural language processing extracts symptoms and risk factors from the internet searches and social media feeds, automatically classify cases, and feeds the enriched dataset into predictive algorithms that estimate spread, identify hotspots, and forecast resource needs. This end-to-end automation speeds detection by cutting hours or days of manual review. It also improves accuracy by reducing human error and bias, delivering data-driven insights that allow health authorities to act more swiftly and precisely. However, AI does have some limitations in surveillance, data privacy and security, data quality and availability, algorithmic bias and inequality, and technical and interoperability issues. Model generalizability and adaptability, transparency and trust, lack of AI skilled workforce, and ethical concerns. There is also a big black box problem. Many advanced AI models, particularly deep learning systems, arrive at conclusions in ways that even their creators cannot fully explain. In a public health crisis, officials need to know why a model is predicting an outbreak to trust it enough to mandate lockdowns or allocate vaccines. If the AI can't explain its reasoning, it is difficult to justify major policy decisions based on its output. Predictive modeling. Predictive modeling in disease surveillance is the use of mathematical algorithms, statistical techniques, and machine learning to forecast the future behaviors of diseases. Instead of just reacting to current cases and numbers, predictive modeling attempts to answer what happens next. Predictive modeling synthesizes historical data, current data, and external variables like weather, travel patterns, vaccine rates to generate probabilities about future trends. It also forecasts the spread, provides data for resource allocation. Let's look at the risk of precision modeling. False precision and reliability. Overfitting the model. Models may be tuned so perfectly to fit historical data that they fail to adapt to evolving situations or novel viruses. False security. Precise statistics, example 12.4% risk, can mislead officials into ignoring actual margin of error or uncertainty. Bias and feedback loops. Self-fulfilling prophecies. If a model predicts an outbreak in a specific area, officials may do more testing. This leads to finding more cases, which falsely validates the prediction simply because more testing was done. Stigmatization. Feedback loops can unfairly target specific neighborhoods or demographics, leading to stigma and skewed long term data. False negatives. False negatives or missed alarms are arguably the most dangerous failure mode in disease surveillance. This happens when a model predicts that there is no threat or that an outbreak will be mild, when in reality a severe surge is coming. The next slides break down the specific risk associated with false negatives. Lost window of opportunity to flag an emerging cluster, isolate patients, and trace contacts in a timely manner. Silent spread. By the time the officials realized the model was wrong, the disease has likely spread exponentially. Unprepared hospitals, not enough time to stockpile oxygen, personal protective equipment, or schedule extra staff. System collapse. The medical infrastructure collapses under unforeseen demand. The all clear signal. If the public is told they are at low risk, they may stop taking precautions like wearing masks or stop social distancing. Erosion of trust. When a community is told they are safe, then hit by a wave of illness weeks later, the public loses faith and are less likely to heed future warnings. In summary, AI enhances epidemiology by processing large volumes of data quickly, detecting patterns earlier, and supporting faster decision making. It helps in surveillance by identifying outbreaks, tracking disease trends, allocating resources, and evaluating interventions. AI should be used as an important tool, but not as a replacement for public health expertise.